wouldn't the junior prom, if it's for next year, be the class of 2017 if they're going to be juniors in 2016?
No. They're juniors this year. The prom's in a couple weeks. It's
okay, I see. Okay, I see.
It's April 25th of this year. And I guess
well, I think what we have to determine is this date correct?
Well, it is correct. It's on the contract. I checked the contract. So.
What I'm saying is that the correct date? Or should it be the class of 2017 and someone didn't bother to change the contract date? We'll have to check. I'll have to get from the I don't want to make any assumptions without checking.
Yeah. I mean, obviously, to Mrs. Yardley's point, this is April 25th this year. The next year, it looks like it's April 16th, so it's kind of moving up, but it's a different date than what's on the first one.
So we'll check.
All right, so that's it for contracts. So now I guess the budget review. So.
Mr. Phillips.
Well, Dr. Phillips is getting set up. If I could just add for this presentation, pupil services, just keep in mind, is not just about special education. I think a lot of people just automatically think that when they hear pupil services, but Dr. Phillips has other departments under his area, such as gifted education, guidance counselors, nurses, school psychologists. So just want you to keep that in mind as he's getting ready to give this presentation.
All right, thank you. Good evening.
David.
Yes.
All right, if you look at the first page, the pupil services budget, 2015-2016, you will see 2014-15 budget was $8,265,537. What I'm requesting this year for 2015-16 in the budget is $8,311,301, which would be an increase of $45,764, which is just slightly over 0.5% increase. In the function codes, 1100, that's the regular education area, professional services and tuition charter schools. And if you turn the page, you'll see in 2014-2015, it was budgeted $1,412,220. In 2015-16, $1,248,286, which actually is a decrease of $163,934. In the 300 account, which is professional services, there are $12,220, which is static. There's no variance either way. In the 500 account, which is the charter school account, it was budgeted last year at $1.4 million. This year it's $1.236066, which is the full variance of the decrease of $163,934. Yep.
Can you explain why? I mean, what?
Sure. What we did, we looked at the numbers of the charter schools. They went down slightly this year, but we also moved some money from the regular education into the special education account because of the shift. It costs a little bit more for special education students that are in charter and cyber charter than regular ed. So the numbers, we moved some money over knowing that there'd be some more special ed kids. So we wanted to cover ourselves. But there's still a decrease when you look at the full budget.
So you're saying you moved more money over, so we're spending less money?
Overall, yes. We moved some money from the regular education into the special. You'll see it later on in the special education charter schools. We actually moved some of that money out of the regular ed into the special ed.
So you think because we over budgeted for this year?
No, we didn't over budget. The numbers have changed. They went down slightly from last year to this year.
The number of students or the cost?
The cost never goes down. There's 6 less charter school students this year. So that roughly anywhere between $50,000 to $60,000 decrease. Plus, there's always the expectation that special education numbers may rise.
Wouldn't that
So there's
increase the budget?
I'm sorry?
If special education numbers rise, wouldn't that increase the budget?
It will in the function areas of the 1200s.
This is just for regular education.
This is just regular ed. You'll see the numbers shift as we go.
So there's going to be another category.
Yeah, which will show an increase.
Okay, it doesn't.
But again, keeping in mind, it's 45,000 across the board
Okay.
as an increase.
Dr. Phelps.
Yep.
Professional services, what are they again?
Well, being that this is in the regular education area, there's a few dollars that are put in there for any students in regular education that we have to account for. Maybe like a behavioral therapist assessment, or any kind of other things that are strictly regular education students. So we put a little bit of money in there for that. And that would be the 1100 series. Now, the largest account that we have, obviously, is the 1200 series. That deals with special education. And then if you look, you'll see all the areas of special education, all the different types of disabilities. As well as the expenditure areas. 300 professional services, that's your psychiatric evaluations. Contracted services, which is the intermediate unit services. Alternative education contract services. The 400 area is the repair and maintenance of equipment. The 500 area are the purchase services such as, and this is the area that you'll see a little bit of an increase, the charter school for special education tuition, as well as alternative education tuition. 600 are general supplies, which are supplies, books, software programs and such. And then the 800 areas, which are claims and judgments. And then overall, the 2014-2015 budget was $6,680,820. And for 2015-16, requesting $6,866,718, which is the variance of $185,898. Again, this is up by far the largest account area, function area, and that variance accounts for the built-in increases with the IU as well as all the alternative centers that don't hold to cap. Okay, and the next slide is the 300 account, which is your professional services, your contracted services. 2014, 2105, sorry about that, that should be 2015. 4,166,105. The increase for 2015-2016 would be 4,211,858, which is an increase of 45,753. The 400 account, which is repair and maintenance, is static across the board. 2014-15, it was 13,851. 2015-2016 is 13,851 as well. That can deal with anything from assisted tech devices, such like that we have to have the students' equipment repaired. The 500 account, again, alternative education, charter school tuition. 2014-15 was $2,010,938. 15-16 is $2,151,0113, and your variance of $140,075. Mrs. Yarley, that's where you see a lot of that money being moved over to cover the difference. The 600 account supplies, books, and software. It's a $70 variance of $38,753, an increase of $38,823. We actually looked at some numbers, and there were some materials that we were ordering that actually had a slight increase this year, so we built in the $70. The 700 account, which is equipment, 2014-15, $6,095. Same number for 2015-2016, $6,095, zero variance. As well as the 800 account, which are claims and fees, 2014-2015, $445,078, and that as well as static for this year at 2015-2016, $445,078. Okay. The next area is the 1400 series, which is alternative education administration. The two areas in there are professional services and travel. And this was a budget of $9,107 for 2014, 2015, not 2105 again. And 2015, 2016 of $9,107, so that's static again, zero variance. And again, it just shows broken down into the professional services with $2,679 and the 500 account, which is travel, which is $6,428. As Dr. Radigan had mentioned, pupil personnel in the 2100 series is all the areas that are under pupil services, which are pupil personnel, guidance, psychologists, social worker, student accounting, homebound services, as well as homeschooling. And in this area is the 300 professional services and training, 500 for travel, 600 for general supplies, which are licenses for software, 700 for equipment, as well as 800 for fees. And in this area, the 2014-2015 budget was $123,804, requesting $144,804, an increase of $21,000. And that the increase is in the area of the 300 account, which is professional services and training. 2014-2015, it was $87,384, looking to increase from 2015 and 2016 to $108,364, which is a variance of $20,980. Again, the 500 account travel, 2014-15 was $15,000, 2015-2016 as a $20 increase based on what we saw as far as travel. 600 account supplies and software was 2014-2015, $8,184, and 2015-2016, $17,559, which is a variance of $9,375. What happened there is if you look at the next, the 700 account equipment, 2014-2015, $11,165, and 2015-2016, $1,790, a variance of $9,375. We moved some of the software, which was placed as equipment, to a different account. So it was just shifting of money again.
Can I ask
Sure.
what caused the bump in the services and training, that $20,000?
Sure, we're actually implementing a new reading program, a remediation program, and then we have to retrain in our former programs.
What's the new program?
I read. It's just adding to the remediation programs that we have. It's just 44 and Read 180.
Is that from middle school and high school?
Right now we're looking at it for high school, but yes, it will go down to the middle school if we find it to be.
So it's just going to
Supplement the original curriculum that we have.
so just as another option for
Yes.
students who don't do
Well, more so an option and another support selection if it need be. For some students that, once they hit the ceiling in System 44, they move to Read 180. We have students that aren't really doing much with Read 180. Once they hit that ceiling, we need another option. So we're researching iRead right now, and that looks to be what we're going to come to the board with for selection.
I have one more question, Dr. Peltz.
Sure.
What do we do with homeschooling in the 2100 series? We have homebound services, which are students with, like, recovering from surgery or illness, correct?
Yep.
What's the homeschooling that we're supporting?
Homeschooling is students that choose to be homeschooled by their parents. There used to be an account for them, and the money that was really used was for reviewing the homeschooling portfolios. That's been taken out of the budget since the state now has seen fit to be evaluators. All they have to do is send me a letter saying that they've seen the portfolio and that it's appropriate. So we no longer have to employ staff over the summer to review portfolios.
So it's listed because,
It's under me. I deal with homeschooling as well.
but there's no money spent?
No, it's just one of the areas that, as Dr. Radigan mentioned. And the last area would be pupil health services. And again, we're dealing with 300 professional services, 400 repair and maintenance equipment, 500 travel, 600 supplies, 700 equipment, and again, 800 dues and fees. In 2014, 2015, 39,586. In 2015, 2016, a request of 42,386, which is a variance of $2,800. Okay, you'll see the 300 account professional services, 8,016 in 2014-15. It's static for 2015-16 at 8,016 as well. The 400 account equipment, 2014-15 at 475, again static for 2015-16 at a 0 increase. 500 account with insurance and travel, 2001-60, again static at 2015-16 at 2001-60. The account supplies is 12,606, again no increase for 2015-16 at 12,606. 700 account equipment, 16,109. An increase there of 2,800 at 2015-16 at 18,909 for nursing supplies, basically. And then 800 account fees at 220, and we stay at 220 as well for increase. And then once again, the full budget, the function of 1,100 at 412,200 for 2014-2015. The request is for the 1,248,286, which would be the decrease of 163,934. Unfortunately, offset by the increase of the 1,200 function of the 6,680,820, and then a request of 6,866,718, which would be the increase of 185,898. The 1400 series, there's no increase across the board. The 2100 series, 123,804, with a $21,000 increase in 2015-2016 of 144,804. And then the 2400s function of 39,586, increasing at 2,800 to the 42,386, with a total of 8,265,537, increasing by $45,764 to 8,311,301, with a percentage of 0.55% in total.
Any questions? So I guess the take from this is that the bulk of this is because of charter schools.
Well, the bulk of it, some of it's from charters. The bulk of it comes down to the IU bill and the alternative ed bills. I mean, that's the alternative ed tuition. Those are the two areas that we don't control because they're not held to cap.
Okay. So how are we doing this year to this budget that the 2014-15 budget compared to how we're actually doing? Does anybody?
As far as my budget,
Yeah.
we'll be under budget again. We're on pace to be under budget one more time.
So this year you're doing.
Once again, it'll be very tight. We were under budget, I believe, 20-some thousand last time. Be a little tighter this year, but we'll make it work.
Okay. Any other questions?
All right, thank you.
Thank you.
Let me stick a fork in. Who's that?
See that word? See what it says HDMI?
Yeah.
Harris didn't know what that
High definition, something like that.
meant. It's the interface, right? He always kept buying VGA.
Who did?
Harris.
Oh.
He was always buying VGA. Almost right.
Now we're going to have a update from Mrs. Johnson on where we stand with the budget in terms of timing and dollars and what we've discussed so far.
Mr. Solis, if I may just interject before Mrs. Johnson starts so I can let everybody know what we've been doing. As you know, Mrs. Johnson made her first presentation back in January and let us know the status was about, same as last year, around a $10 million budget deficit. And since that time, the cabinet members have been meeting and we've brainstormed as many possible ideas as we can think of. As you can imagine, some will be more painful than others. And Mrs. Johnson and I meet on a weekly basis, so she's constantly updating with me with information that she receives. A lot of this, as you know, is a waiting game because we wanted to see what the governor was going to say. And although a lot of his ideas sound very promising, we're taking the conservative approach because we can't be guaranteed that what he wants to do will be able to happen. We also were in a bit of a waiting game, as we typically are, because we don't know for sure until April 1st who all of our retirees will be. So we have a better handle on that now. So Dr. Bavard and Dr. Phillips have been working with their staffs trying to look for as many efficiencies as possible. If you recall, the board approved the sister schooling proposal again for next year, which we know saved us about $250,000 this year. So that's a way of being more efficient. And we are giving you these presentations for each of the departments. So tonight, Mrs. Johnson is going to update you with information that we have now that maybe we didn't have before, with some suggestions that we think are viable for you as we try to whittle this number down. So we are hoping to, you'll see that we're in a better place than we were before, but we still have a ways to go.
Is this on?
Yep.
Okay.
Break it.
Mr. Torado, can you help me, please? I should have brought my own computer.
She lost her document. Oh, there it is. It's back.
And just to let you know where we're at currently with the preliminary budget, as you know, we have the Act 1 timeline. We adopted that preliminary budget back on February 12th, and we have been working and updating the budget since that time. Both Dr. Radigan Center and I meet weekly, and also with the board as things become available. We actually did apply for a referendum exceptions as required. And we are actually through the first page and well on to the way to the second page. And actually now into the third page where PDE did rule on our request for referendum exception. That referendum exception was granted, and when I get further into the presentation, I will show you what that amount is. Continue to update these timelines as we go along here up until June 22nd when we have that final budget presentation. Right now we're still showing with a 1.9% real estate tax increase, which is the Act 1 index, our revenues to expenditures, we would have a just a little over a $10 million deficit that we need to close that gap. Okay, this is our PDE referendum exception. Our current millage rate for 2014-15, the maximum would be 129.6227 under the Act 1 index. With the referendum exception being granted, 14-15 is 129.6227. The 1.9 Act 1 index is 132.0855. The referendum exception mills that were provided is 1.8524 with a maximum mill of 133.9379. With the Act 1 index plus the referendum exception, our total mill increase could be as high as 4.3152. Adding that additional 1.8524, this would be an increase of 131.31 to the median property value assessed at $30,430.
What's the percentage of the properties capital? For the exception.
I'll have to calculate that. I did not put that on my slide, I'm sorry.
Will you send that to us?
I will send it to you. Okay. Again, we're showing our total of expenditures of $133,419,581. This is just a repeat of the slide that was shown previously. Again, same way with the general fund balances. Did make one slight change to the fund balance projection as I'm going through and looking at projections. I do believe our unassigned fund balance will remain at 6.645408 for the 14-15 school year. I will continue to update as we get closer to passing that final budget. As I get additional information, I'm reviewing purchase orders that are still encumbered, making sure that we really are going to purchase those things. If not, I unencumber those funds become available. So again, that is a process that I'm doing on a monthly basis. I'm working and meeting with cost center managers, reviewing some of their accounts. For those that have encumbrances that look larger than what they were last year, and just double checking to make sure that they really do want to still have those numbers set aside for any procurements through the end of June. Okay, I'm also looking at revenue projections, and our revenues are coming in slightly higher than what I had projected in the budget. We're having one area that's coming in higher than what I really anticipated are still delinquent taxes. There does come a point where delinquent taxes should start to go on the downhill slide, but right now we still saw an uptick in those a little bit more than what I had anticipated with the last month's revenues that we received. Going on to the governor's budget, the governor, one of the things in his budget proposes a 4% limit on unassigned fund balances. Right now, we can have anywhere up to 8%. Our own fund balance limit is between 4 and 6%, and right now we're just slightly over 5%. But if we were using the governor's suggested 4% limit on unassigned fund balance, and that's 4% of expenditures, we would be saying that we would have an excess of $1,308,625 that we would need to spend down in some way in order to be compliant with the governor's budget. A couple of ways that we could think about spending down that budget, fund balance, is several ways. First of all, we could transfer the whole amount of money to capital projects, and that would be the end of it. Or we could use that monies in the general fund to help fund some of our non-routine maintenance type items. One of those being the non-routine maintenance budget, which is $650,000. Mr. Loeffler will be getting all his bids back in for the next facilities and finance meeting, so we'll be able to determine if 650 is the right number or if it's even some number lower than 650. We certainly are hoping for a number lower than 650, but we will have that information in May. The technology transfer that we have been discussing for several years and continuing to put monies aside so that when we have another future technology infrastructure upgrade, we will have money set aside. Just as in the past we set monies aside for building infrastructure updates, we also need to do something similar for technology so when those things come up, we're not scrambling and trying to find $1 million at one time. Buses, Mrs. Armbruster last week presented a proposal for buses. And that proposal, I think she came up with, I'm sorry, I don't have it in front of me, approximately $950,000. And we said we already had some money set aside. She had asked for a $750,000 transfer, but when you added those two numbers together, subtracted out what she thought she needed, we really only needed another $195,118 out of this budget, not the $750,000 to purchase the buses this year. Now, of course, putting $750,000 and transferring it to capital projects gives us money then towards buses for next year, but if we're really looking at balancing this budget, and we're gonna say, we're not gonna think about buses for future years. This is one way, we can balance that as well, reduce it. And Mr. Loeffler also has some vehicles and mowers in his budget, which amounts to $48,600 that we could use, again, for a one-time expenditure, and then any other non-reoccurring expenditures to be identified. But again, we're looking at spending these dollars or transferring these dollars on things that are non-recurring. I'm not asking you to use them to pay salaries or benefits or the electric bill or the water bill. These are things that, at the end of the day, could we pare them down and still be able to provide services to our students? And the answer is yes. And as Dr. Radigan said, we have been meeting, both Dr. Radigan and myself, as well as Cabinet, to come up with ideas and ways to balance this budget. And we will continue to work on this. This is where we're at as of today. The deficit, as we said, is $10,398,262 as stated. Use of the fund balance for general fund, as I just mentioned, $1,308,625. The PSERS commitment. If you decide not to go with the additional monies that would come from the referendum exception, I would suggest that we at least take that amount of money out of our PSERS commitment, which is $1,092,839. If you'll recall, 2 years ago, we said we were going to use some monies out of our healthcare fund because we had that balance that continues to grow. Well, we did that. That would happen to be a year that we had very good experience, and that our healthcare costs did not grow as much, so we did not really reduce that by the $2 million. So we're going to try, I think we can try again for next year to use some fund balance to reduce that fund. We have what's called breakage, and right now, Dr. Rag and I have come up with a number of $400,000. That's, we're looking at, basically that's 8 teachers, $50,000 each. We are not final on that number. Dr. Radigan is meeting with staff and looking at various other things to see if that number could possibly increase. But right now, conservatively, we've put $400,000 in there. The lease purchase for the one-to-one program, we have that in as $538,000. Again, that number could change upward. We do not have final pricing yet on the computer that we're going to buy. Excuse me. Nor the final count. So as soon as the final counts are in, we go to the vendor, we tell them exactly what we're looking for, they give us our pricing, we work through the leasing to see what the multiplier is for that. We can tell you in June what that final lease versus payment purchase price is going to be, but it will be, we believe, at least $538,000. Our estimated savings on bond refinancing for our bond is estimated at $147,392. Mr. Willard will be here on April 27th. That is the day the bond sale will commence, so we will know on April 27th what that final number is. The estimated savings for the bond refinancing at Upper Buck Technical School is $20,000 for this year, so we've taken that out. And one of the other things Dr. Phillips has done, UBELA, which is one of our alternative placements, we are going to reduce the number of slots that we have been paying for, and that's $180,000 that we will be removing from the budget. So as of right now, we're still looking for $4.7 million. We still have some work to do, but we do believe we will get this down to something that is more manageable than $4.7 million.
Yes, 3.9.
Kathy, refresh my memory, the $10,398,000, that was the deficit with a 1.9% increase?
That is correct.
Where am I?
In the presentation, you say that Governor Wolf's budget proposal includes putting a cap on unassigned fund balance.
That's correct.
Could you use your microphone, please?
It is on. So if he doesn't, if that budget isn't passed, are you still proposing that we reduce our unassigned fund balance?
Well, our own board policy is 4 to 6%, so we would still, reducing it to 4% is still within our own board policy. I do think that, again, either some variation of that, using some of that was just one suggestion. Of course, that truly would be up to the board to use those monies. If not, then we would be looking to cut and remove some other expenditures from the budget.
Mrs. Johnson, the $1,092,000 in the balancing the budget section, would that's it's like $7.5 million set aside around there, right? Would that be $1,092,000 come out of that $7.5 million? Is that
That's correct. We would be reducing the PSERS reserve by that $1,092,839.
So I may have missed it, but how did you arrive at that?
That's the amount of money that we are authorized under the Act 1 referendum exception to increase taxes to. And I do have to say, and just reiterate what Dr. Brodigan said earlier, nothing here that we are doing eliminates the structural deficit that's being caused by PSERS. Because for every $1 million that I take out of the PSERS commitment, those are monies that are either going to have to be raised in taxes in some future year or raised by reducing some other expenditure in future years. So really, none of these things here reduce the structural deficit. They're pretty much all one-time types of savings. They're not, we're not going to see these savings for these same things year after year. I mean, I think last year being 14-15, about this time, we were talking about a $600,000 savings in bond refinancing, and we took that up front. So now this year we had to put that $600,000 back in. So we're talking about the same thing here. This is an approach to balance the budget, but it does not do anything for the structural deficit. And the structural deficits being caused by PSERS can unfortunately really only be fixed, if you will, by eliminating some type of fully eliminating some sort of expenditure down the road.
On the healthcare fund balance, that's the $2 million is what we used last year. I thought we only used $1 million last year.
Right, we did not use the $2 million last year. We still are at a fund balance of around $9 million in that particular account.
Last year or this year?
That's as the end of last year, end of 13-14 on our audited financial statements. Again, we are trending very well this year, again, with our expenditures. I'm going to knock on wood here. But again, we've had a good experience. So we're looking at that not going down the $2 million that we had anticipated, even over 2 years. It's not decreasing by $2 million.
So my real question is that the most you can squeeze out of that, or are you still?
Again, I think it's something we can look at as we get closer to June. Again, we're looking at information through March. We still have 3 months of claims experience. And really that June claim experience, I'm not going to get until July, so we will have to make this decision based on pretty much 10.5 months of claims that have been paid, because claims, they have up until 30 days and 60 days to process them, so that's why I'm saying 10.5 months.
So you have like a 90-day lag time? 90-day lag time on the bill, I guess.
Well, it's not.
But that's okay. I don't want to get it done. I guess so. You're still looking at it.
We're still looking at it. We believe this is for right now, this is a conservative number that we are comfortable with without having, the full year's worth of data.
If I could just piggyback on the healthcare, one of the things that we've done this year is we've asked for an audit for all of our employees where they had to actually fill out a form and say, who's on your insurance and who are we paying benefits to, and we have definitely found out, some people just forget to do it. You know, if one of their children turns 27, for example, they're no longer supposed to be somebody we cover. So we definitely found quite a few cases, and I'm trying to get a handle on, did that cost us any money this year? Of course, if those people didn't have any claims, that's, you know, a different story. But I just wanted the board to know that that's another area we've looked at to hopefully get some savings.
Any other questions? Kathy, I have a question that doesn't necessarily pertain to this, but our Secretary of Ed, Pedro Rivera, I guess requested school districts to delineate how they're going to spend their increases. Is that something we have to do? Is that?
I think it was a request, Dr. Riding, and you have the letter. I'm not quite sure how that letter was worded. It was sent to the superintendent, and it was not a formal, I don't believe it was a formal grant application.
No, but there is a list of certain items that you have to use the money for those items.
But I thought they required school districts to actually respond saying, here's how I'm going to spend the money. I thought that was a requirement.
If you're going to use it, you will have to do that, yes.
I just didn't know if we were spending time doing something. But you haven't done anything like that.
We haven't done anything, and again, the categories are rather broad and things I think that we can probably, and Dr. I think you would agree that these are things that we can do. Tutoring, some of it was technology related. I mean, things that we currently do, we are doing and we could expand and or continue to do rather than taking it out of the budget.
Okay, I guess if there's no other questions, I believe that's all on the agenda for tonight right now. Yes, okay. So, public comment? Anybody want to comment?
Yeah, I have some questions. I have some questions.
Sue Furlong, West Rockville Township. I have a couple of questions about the budget. First of all, I want to tell you I must be clairvoyant because I saw 4 or 5 things I told y'all about a month ago, if you recall. But we sent it to Harrisburg, inflated to $10 million anyway. We call that fraud. Question, I was looking at the PSD website. Why is the 2014 audit not posted on the website?
Well, it should be, but we'll check. We'll check.
The Maui Falconero report? That's what I'm talking about. The Maui Falconero report is not there. When was that finalized?
So, when was it? December, yeah.
December, and this is April? Okay. I didn't see on your deficit reduction any additional reduction of the deficit by the rising EIT tax revenues. I think they went up about $700,000 last year, this year, and the year before that perhaps also a certain amount. Is there a reason that that's not being included in the deficit reduction?
Why? It was, the revenues were budgeted for this, you did a budget of what you estimated our EIT revenues are going to be this year.
I believe that the last I heard that was held flat year to year,
Well,
but they haven't been flat the last couple of years as the economy improves, so I'm curious why that would be held flat, because that's worth about $700,000, usually 500 to 700, sometimes a little more. That would help so you don't have to raise taxes so much.
Well, that may be something we look at as we go along, once we,
Okay. I have been told in the past that there was an annual, review of the insurance dependents, and now I'm finding out that there's a whole bunch of ineligible dependents. I don't think that happened in a year. I'm just kind of curious why that was allowed to go on, if that's, I mean, that's what it sounded like. And if I'm wrong about that, just say so, but it just sounds like what I was told previously was not accurate. If the reserve for medical is coming in under budget, we have $2 million there. I'm curious, is the current budget been adjusted for the fact that perhaps when it was put together, the assumptions were that we would have to spend more, but our experience is saying, no, we don't have to spend more? So was there, besides just what was left over from last year, was the upcoming budget reduced by a similar amount? I didn't see that in the deficit reduction.
Well, you can't reduce budget based on potential maximum claims. The two aren't related.
I think they are. Your claim experience, that's what the insurance company uses, is claim experience. Am I not right?
Yeah, but unless your group changes, why do you, what changes the number or the loss pick that the actuaries would pick? They don't change their loss pick because we got lucky. They still budget, we still budget as we follow the actuaries guidelines, correct?
Okay.
You wouldn't, one isn't a function of the other.
Mm.
As a result, we had a positive, what if we under budgeted? Would you say we under budgeted because we had a horrific year? We still budgeted it correctly.
Well, it's an estimate, and you've been high the last 2 years from what I understand.
We haven't been high, we haven't had the claims that were anticipated.
I believe then your budgeting high.
Well, you could say that.
Yeah, I think I could. All right, thank you.
I have decided a little curious about the VAT tax. Have you shown that in the budget that it's rising instead of holding flat?
So I don't have my budget in front of me right now, so I did change it from last year's budget projections. Last year's revenue. What's in the 14-15 budget is not what's in the 15-16 budget.
Could you share that number with us when you get a chance?
Sure.
okay, I guess we're done then. The next meeting, is that a combined meeting on May 4th, right? Next meeting will be